What's the difference between sinus surgery and balloon dilation?
Functional endoscopic sinus surgery and balloon sinus dilation in the office essentially are trying to achieve the same objective, which is to restore the natural outflow tracts and flow patterns of mucus from the sinuses into the nasal passages and restore basically these normal functioning pathways. Therefore, the number functional endoscopic sinus surgery. The main difference, though, is that the traditional surgical approaches in functional endoscopic sinus surgery oftentimes involve removal of tissue, more aggressive techniques, and then, of course, oftentimes they need to be done in the operating room under general anesthesia. What we've learned over time when it comes to the sinuses is that oftentimes for disease that's not extremely severe or some other abnormal cases, less is more. The less aggressive you are with the tissues, the less aggressive you are with the structures that are there for a reason, really the normal anatomy, the less likely it is that you will have complications in the mid to longer term, such as scar tissue and other problems that can actually bring the disease back. Functional endoscopic sinus surgery addresses the same areas of obstruction, but the whole goal, of course, is to open up these nasal passages and these sinus drainage pathways by dilating and expanding the natural pathways that are already there, but not necessarily modifying the anatomy or cutting tissue or removing tissue too aggressively. So we can achieve the same level of success, the same excellent outcomes, but without affecting the underlying normal structures, and then give the patients relief and not risk potentially some of these longer term consequences that can come from more invasive and more aggressive surgery.
Sinusitis, we know how to treat it.